Today's presenter is Mary Bowron. Mary is the Chief of Quality and Resource Management at Washington Hospital Healthcare System.
I would like to spend some time tonight discussing some of the recent hospital rating systems that have been made public that relate to quality and patient safety. Over the last 10 years, this has become a bigger focus. There's a lot of different agencies out there reporting different metrics and looking at and publicizing different numbers. And I think for a consumer, it's hard to understand, what these ratings mean, what are they based on, things like that. So we thought it would be good to let the community have some background understanding on how these things are calculated and sort of some guidance on how to interpret them. Some background on this is that most of these rating systems have very diverse approaches to how they do this. That often can lead in each agency having contradictory results and or findings. And that's mostly related to the fact that some of them use different definitions, they use different criteria in their approach, different methodology, even different sources of data. Something as far as CMS is something as far as data that the hospital has provided and to them directly. It can range drastically. And as a result, there is actually, if you look at the real detailed research about comparing these systems, only 10% of hospitals rated as high performer by one rating system are also considered it by another. So a great deal of variation that we need to be aware of. And the next piece of it is that in California, there are even a greater amount of these that we need to be looking at. There are over a dozen of them. So what we've done here at Washington Hospital is just really try to stick to what are our fundamental beliefs. We want our transparency in our data. We want to identify our problems clearly and openly and be able to take interventions to improve those. And we have been able to stick to that by making sure that our data is valid and it's comprehensive and it's shared and it follows really some really national support systems and resources available. So the rating organizations that continue to be more in the media focus lately, there's some things to consider with them. Many of them you have to, use the term pay to play. And that payment can be a little difficult to understand, but the key message is that many of these organizations do get a financial benefit to having you participate with them. And one of that may be something as simple as Leapfrog, for example. You can pay a licensing fee to then have your score advertised. There's different tools that these agencies can offer you per payment or a subscription. Subscribe to us and then we're going to be able to advertise for you. These sort of things that need to be considered, that there may be some financial incentives in data and how it's public. Something to definitely keep in consideration. Washington Hospital acknowledges that ratings are public. We see them throughout. We appreciate the fact that they're focusing on quality. We just would like to make sure that everybody has an understanding of what's valid and what's clear. So in getting to that, you can look at this long list of, this is about 19 different examples of quality rating systems. Very overwhelming to even me who was worked in quality for a few years and has to look at these every day. I even still have a hard time, deciphering it. Can you imagine an average consumer trying to wade their way through this? So some of our ratings that are specific to our hospital recently have come out, and there's a couple, just to give you a couple examples. With consumer reports, we've been rated excellent with physician and nursing communications with patients. That's a big factor. Communication is probably one of the best ways you can get great quality in your hospital. Health Group rated us on an 88 on a scale of 0 to 100, another great success. And then you look at a score like we have here with Leapfrog. We didn't participate fully in some of the things that they were requesting for the reasons that I mentioned before, because we can't participate in all of them, right? And so then sometimes your rating can be given differently because you're not participating. So something to take into consideration there. US News ranked us the 5th hospital in SF metro area, and considering the hospitals that are around here and what great quality a lot of them offer is a great compliment to the organization. Specifically moving into awards. So there's rating systems, as I discussed, but then there are also awards that hospitals can get. One of the most common ones that consumers see are health grades. And health grades is a system that is based on star ratings. And they give us basically general surgery excellence awards, patient safety excellence awards, things like this that we've been able to receive are real achievements of success in our quality data that health grades has really looked at in a comprehensive manner over a long period of time. So it ends up being a much more trustworthy source of data. I think everybody in here is familiar with Joint Commission. We've heard a lot about it. Joint Commission was at our hospital this year twice. The great outcome we had was stroke. We also had a great outcome with our overall hospital Joint Commission survey. Highly credible source to look at for how hospitals are judged and determined on their quality in the facilities and services that they offer patients. It's key, it's federal, even in parts of international in the world. So Joint Commission should be taken very seriously, and we've had some good successes there. Moving on to data reporting at Washington Hospital, a huge focus on what we do in quality is looking at databases and how do we report to them. Some of them are mandatory, some of them are voluntary, some of them we participate in so we can learn. One of them is our cardiovascular databases. We looked at all of our cardiovascular surgeries that we perform here, all cardiac caths, things like that we participate in on a voluntary basis because we want to know what's the outcome of the data that we are having with our patients who are receiving those services. Those are a couple examples. We report everything from a county level for our Alameda County Public Health Department. We report things to them daily, all the way up to federal CDC participation. Very comprehensive set of data reporting that we've done here at Washington Hospital. Again, not all required. We participate in many so that we can know where should we make our improvements and have data that we can look at in a meaningful manner. Centers for Medicare and Medicaid Services, they provide a star rating system. And this is otherwise known as CMS, of course. One of the biggest organizations on a federal level that is looking at your quality that we send them based on claims data, based on data that we report to them. And they rate it on a 1 to 5 star scale, which is much easier for a consumer, I think, to understand. And basically, that gives the consumer the ability to make informed decisions on where they may choose to have their care. One of the things I like about the CMS, our star rating system, is they take the data very seriously. It's comprehensive. There's a lot of data that we send them. They validate the data. This year, for example, we were validated. They come in, they say, I want 3 samples of the charts on how you did with core measure abstraction, things like this. And then they report back to you. They go to really great deal of effort to validate your data. This is a very credible source. In our last 2 validations, we've received over 90% match rate for what they were looking for. And so they feel like our data is very valid for what they're receiving. And actually, we have moved, the latest published data is that we had a 3 out of 5 star rating. We just actually moved up to a 4 out of 5 star rating as I received that notice last week. And that will be made public on Hospital Compare. Very reputable source, very comprehensive, requires a lot of data to be submitted, but it helps us understand, where are any issues that we would have around readmissions, patient experience. There is another thing they determine when they give you that score, timeliness of care, even right up to medical imaging, all these things. So 4 out of 5 is a good score from a comprehensive source. Health Grades is another one that they focus on your general hospital quality over time, and they also publish your awards for excellence in patient safety and experience for your top 10% of facilities. And they also give awards to hospitals that perform well over consecutive years. Another good source is Health Grades because they're looking at a high volume over a large period of time, something the consumer should consider a reputable source for sure. U.S. News and World Reporting, another popular one that you'll hear about a lot in the media. They have provided hospital ratings for about 30 years. They have a great deal of experience in this. Their quality metrics tend to be objective and changed to match the evidence that changes over time with what they want to be looking at. They also look very closely at Medicare data, which is one of the most popular sources of data that you can find out there right now to look at and measure quality on. And they rank our scores differently according to metrics that I had just mentioned, similar to Health Grades. Readmission, survival rates, things like that are what U.S. News and World Reporting ranking is looking at. Leapfrog Group, I've mentioned them a little bit before. I want to keep in mind that this is a voluntary group that you can participate in. And like I said, we've participated in the bigger, more comprehensive ones that I mentioned before. Leapfrog is not something we voluntarily participate in, so they don't have access to really all of our quality data. They go to a secondary source with Medicare. They get this data, which then makes it to be in periods of time that could even be as far back as 2 years. And if they don't have access to all of it, then you don't get as comprehensive of a report. So that's one that, we take a little bit more into consideration with, it's one that you should probably think much more closely about when you look at that score. 80% of hospitals receive a C or less grade because of this, because there can be little areas that are missed in it because, again, unless you're volunteering, they're not going to get the comprehensive scene on your quality, right? Not to the same extent that CMS or Joint Commission or much more bigger reputable sources would see. We recognize that we need to have a strategic approach to how to review these ratings. They're out there. Many of them are public. Again, confusing, need to be reviewed currently on a basis that we want to be looking at them anytime they're published, reviewing them so that we understand what is in this score, where did they come from this, what's the time period they used to look at it. These sort of things need to be considered. So for us, factors that we're considering is how current is the data. So for example, if you're reading a report from Leapfrog or something, and you say, oh, they have a problem with multiple drug resistance there. First question is, when did it happen? Are they reporting something from 2013? And here we are in 2017, made significant strides and improvements in those. And that is something that is not even being made public because the data is older. So, and is it validated? That's a key question in this. As I mentioned before, CMS validates our data. And so those scores can be considered very accurate because of that. So it gets away from the subjectivity, basically. How transparent is the methodology? Methodology meaning, how did they calculate this data? Where did they come up with this number? Is it biased? Were certain cases excluded? Were they not? Are the definitions standard definitions that CMS or Joint Commission would use? Or are they something this agency is looking at in a much more different light? So things to consider also with that. I already mentioned the time frames and how important it is to look at that. Does the rating system look at actual clinical outcomes? So how did the patient do when they left? And what were their outcomes? And did they return to the hospital? These sort of things you really have to be able to consider when you're looking at that. And again, very important part to remember is the hospital required to pay to have these made published or marketed in a different way? Of course, changes some of those results. So our future direction on focusing on this is we recognize there are many sources for this. We have a responsibility in quality to keep the community informed on, what's reputable, what may not be, and help them understand the differences and the sources. So we'll continue to focus on that. And that's really driven by the patient-first ethic. All data that comes through Washington Hospital and is looked at in the databases and the sources is looked at in a manner of what can we do with this data to make it meaningful? What can we do to improve the patient experience here? What can we do to improve their outcomes? That's what our focus is going to be. That's always been the mission. That's what we continue to want to do moving forward with our data, in spite of what 10 or 12 other agencies may have different interpretations. We want to continue to focus on what we're going to do based on the patient-first ethic to improve our care here with that data. We also want to make sure that we're reporting to all required necessary organizations. As I mentioned before, CMS, Joint Commission, really the backbone of where data goes and where we can trust some of those outcome sources. A lot of that will be involved in looking at patient safety and making sure that whatever quality data that we bring and patient safety, that the board and the community hears about it every month. That's key. It's been a focus here. That's not something you'll see around in a lot of facilities. And so we've really tried to keep transparency here so that we can keep everybody informed and let them know that we're doing with the changes and what we're seeing with our data. And then, of course, the ultimate goal, and one of the parts that most hospitals struggle with is, how can we sustain it? So we've seen some recent decline in C. diff, for example, that we're hoping to see even further decline the rest of this month. And I was meeting with Dr. Martin, our ID physician today, and she said, okay, so now we're moving on to how can we sustain that? We're making some real achievements there. The data is coming down, again, based on a source like CDC, federally definitions that are provided to us, and a great source of data for it, but what can you do to sustain? And then as you identify quality problems, what new initiatives would we be starting based on the quality that we're looking at reputable sources? That's our goal with sort of handling this big source of data.
Wow, thank you, Mary. Any questions?
Yeah, Mary, I have a question. In your opinion, what would be the top 3 or 4 rating entities which rely on validated current data? What should a consumer, if they're going to pick just a handful of agencies or entities to look at, which entities are in that top tier?
Yeah, I think that's a great question. The first thing that I would look at is Hospital Compare because it is it's very easy for
That's
a
CMS,
consumer,
correct?
which is based on CMS data. Exactly.
Okay.
So it's called Hospital Compare based on CMS data. What I would encourage people to do is really pay attention to the time frames because they report sometimes a little bit after, but it's a great source and that's validated. As I mentioned with our example with our 90% compliance rate with that, I would go to CMS. Joint Commission is a friendly website. Their data is not as publicly made on there because they just rely on the CMS one. Another one for people living in California is California Department of Public Health has a website, fairly easy to get through, that will give you and list all hospitals and where they rank, especially with healthcare associated infections. Very easy to understand. Red star, yellow star, a green star. CDPH website's great. And you can compare the hospitals around you. They validate. We're not required to have them validate. For the last 2.5 years, though, we have invited and volunteered to have them come in and validate our data. So I feel very strong in the data that's publicized there. Those would probably be the best resources to go to. And they also have things on there that will help people with language barriers. So you can kind of, look at alternate sources of getting it translated into different forms of language. And they'll call, and you can call and they'll help with that.
Great, thank you very much, Mary.
I might be cynical about this, and I apologize for that, but it seems to me CMS, that's the governmental agency that they are paying us for the services that we provide, and they are providing grades, and they're paying us. Organizations like Leapfrog expect us to pay them, and so. And you don't.
Yeah.
So I'd rather trust the folks who are paying us than folks who expect us to pay them.
Absolutely.
In terms of how we are scored, because I don't believe that we'd be getting the payments we're getting if our grades weren't significantly better than most. So.
And the CMS data is far more complete.
Yeah.
When you look at the list of 19 or so or more companies that do this, I made the decision that we weren't going to pay everybody to rate us.
Correct.
We can't afford it.
Yeah.
And the amount of time and energy it takes to submit all that data to everybody and all their different ways of receiving it could cost us a fortune.
Sure.
And there is enormous inconsistency from one rating company to another, and some of them, like Leapfrog, mix up years.
Sure.
They'll take 2013 data for one thing and 2015 data for another, and they won't tell you that they've done that.
Yeah.
And the rules of biostatistics are very clear. You have to compare like things and
Sure.
like years and like
Sure.
groups of information. And they seem to go off-road when it comes to that.
Yeah, it's a shame. Yeah.
It is a shame because it creates
Confusion.
impressions in people's minds without disclosing how they got there.
Yeah.
And so there are hospitals now that are suing Leapfrog. There's one in West Virginia. There's another one in Chicago. And I'm sorry, I'm not paying them
Sure.
to do this.
No.
We just can't pay everybody.
No, that would. No,
After a while, you
that's
begin to
form-
feel like you've been,
That's-
this is a stick-up.
Yeah, it is. Yeah. Well, thank you, Mary. Thank you for explaining this. I know it's very confusing.